Good afternoon. My name is Ariel Morrow, and I'm here to speak about the social determinants of health and the determinants of healthcare disparities. This is a project for my racial and ethnic healthcare disparities course entitled Vlog 2. Good afternoon. I am, as I mentioned, reflecting on the determinants of health and healthcare disparities. And in today's vlog, I will be exploring the social, behavioral, and environmental factors and sharing how these lessons connect to my experiences growing up and to working in underserved communities. In this video, I would like to discuss surprising insights that I've gained from this course, as well as practical ways that I can apply these ideas now, as well as what I will be able to carry forward in my future career. So first, I would like to touch on the social determinants of health, week 4. When we discussed the social determinants of health, it really hit home for me. Growing up, I remember hearing stories from my father, hearing his firsthand accounts of the systemic barriers that he faced in his community of Third Ward growing up. From my dad's stories about the historic Yates High School, growing up in Third Ward, in the CUNY homes, which is it's government housing, even into my own work personally in Houston's 5th Ward, the impact of socioeconomic healthcare disparities is undeniable. A surprising or one insight that stood out to me was how systemic inequities can persist for decades. Working in a small church in 5th Ward during my MPH practicum to implement the Healthy Elders program gave me a front row seat to what underserved really means, as it was very humbling and very eye-opening. Week 5 taught us how behavioral choices are often shaped by structural conditions and not necessarily by individual failings. This made me think about how much I've seen people blamed for poor health, when in reality, they've been set up to fail by society due to a lack of access of resources, education, or access to healthcare. Programs like community health worker initiatives, as well as community-based participatory research, show how important it is to empower individuals to enable them to lead healthier lives and adopt healthier behaviors. And it serves as a reminder that as future healthcare practitioners, we need to focus on changing the systems and not just changing the individuals. Environmental health disparities, um, which was week 6. Um, we learned about the environmental determinants of health. Um, this topic also hit very close to home with me in Waller, Texas, in Waller County, near my beloved alma mater, Prairie View A&M University. At that illustrious institution, they tried to place a landfill right next to our campus. During my tenure there was a vote by the people of Waller to implement as a solution to the burn ban a landfill instead. This serves as a blatant example of environmental racism. Would they have considered putting a landfill right next to the school if that population weren't predominantly Black? This made me realize how environmental injustice is a direct assault on health inequity, on health equity, which is a health inequity. It's not just about polluted air or polluted water. It's about a systemic disregard for entire communities. It's about a systemic disregard for someone's humanity. And it's personal to me because I've lived it. In week 7 and 8, we discussed addressing health disparities through achieving health equity. During my group's presentation, I made an analogy of how achieving health equity feels like Sisyphus pushing a boulder uphill. In Greek mythology, this was a curse that was befallen upon this person, which was seemingly exhausting and seemingly endless. This is an analogy that reminds me that persistence matters. Even small steps towards equity can make a big difference in people's lives. It's easy to feel discouraged, like, when are we going to stop pushing this boulder up the hill? But as we keep doing the work, we keep chipping away at the injustice. Every program, every intervention, every research study, every evaluation that's conducted, it matters. We're not just fighting a battle. This is a movement. And in 5 years from now, I want to remember that health equity is not just a health outcome. This is a process. And during this process, it's important to stay committed, even when progress feels slow. Therefore, I will commit to the responsibility of carrying with me these lessons of resilience, these lessons of resistance, and these lessons of the power of community. Knowing that change is possible, especially when we work together. And this is why I will continue my journey as a public health practitioner. Thank you.